Tonight is all about concussions, and there are a million different ways folks can get concussions. I think tonight we're going to be talking a lot about sports concussions and getting a lot of different perspectives, but people can get concussions from falling, from being involved in motor vehicle collisions, from being bopped on the head. We have here, a lot of sports pictures. I love boxing. The whole idea in boxing is to give the other guy or $1 million baby girl a concussion, but you can get it from soccer, from football, basketball, baseball, kickboxing. There's probably not a sport where it's completely concussion-free. Greg Louganis in the Olympics some time ago hit his head on the diving board and got a concussion. But clearly, contact sports is the way in which it often happens. And concussions are a big deal, and I think that, we know that they've been around for a long time, but it's just recently where it's gotten a lot of media attention because of what's happening in professional sports in the NFL, in Iraq and Afghanistan. Mild TBI or concussion has become the signature injury of those wars. So I think we're understanding a lot more about it, and understanding also that concussions are a big deal. And if you just take a look at just how common concussions are in the country, don't worry so much about these statistics. The quiz really won't be that so hard at the end of the talk. But it's actually very common, and there are well over 3 million people in this country who have a long-term problem associated with having a traumatic brain injury. And that's what concussion is. It's a mild traumatic brain injury. So it's actually fairly common. And it's particularly common in sports. And this number of 1.5 million, the number of folks with concussions who wind up going to an emergency department, most of those are mild injuries. But as it turns out, it truly underestimates just how common concussions are. If you just take a look at sports concussions, there's an estimate there are close to 4 million concussions in this country every year. Most of these folks either never make it to a physician or a healthcare provider, certainly never make it to an emergency department. So this is really a big problem. And we often refer to concussions or mild traumatic brain injury as a silent epidemic. It's actually, it's really quite common. And we're just beginning to realize now that it's not so benign. That although most people get better, there's a significant minority of folks who go on to develop some longer-term problems. Now, one of the reasons I'm sure that you're here tonight is to really learn about concussions, and part of this has to do with the fact that last summer, Governor Cuomo signed into law the New York State concussion law, and New York State became the 33rd state in the country to develop such a law, 33 states plus the District of Columbia. And I think a lot of you may be from the school systems, and a lot of this is going to apply to you, and perhaps that's why you came here tonight. But the New York State concussion law has some key provisions that are really important. Perhaps the most important is really making sure that we're protecting our children, children who may have had a concussion, children and adolescents. So one of the key provisions is to make sure that any kid who has a suspected concussion, even if you think they had a concussion, even if you're not sure, they have to be removed from play immediately. And they're not allowed to return to play. And when I say play, and you're going to hear more about this later on in our talks today, but they're not allowed to return to play or practice or any type of physical activity, really, until they are completely without any symptoms related to that concussion for at least 24 hours. And this is mandated now by the state. They also have to be cleared by a physician, ideally a physician who knows something about concussion, and we'll talk more about that later today. And also, particularly for the folks here who are from school districts, it's important that each individual school district develop a concussion management team that's going to provide education regarding concussion. What is a concussion? What are the signs and symptoms of concussion, and how to treat them? This is geared mostly for coaches, for physical education teachers, school nurses, to some degree parents as well, but other school personnel. So we're going to actually begin to bring that to you tonight, and I hope that it's in a manner that is helpful for you and you can bring back to your own work in school. One of the questions, though, I think that is confusing to folks is really, what is a concussion? And this actually creates a lot of discussion, and quite frankly, if you go to the literature, there are a million different definitions out there. There's mild traumatic brain injury, minor TBI, minimal or minuscule TBI. It's all over the place. The American Congress of Rehab Medicine actually has a pretty straightforward definition, and basically what a concussion is some blow to the head that can either be direct, blow being hit or falling or just kind of shaking your head, if you will, that causes some alteration in somebody's mental state. It may be that you could lose consciousness, although it's important to note you do not have to lose consciousness to have a concussion. If you take anything home tonight, let it be that. Well, there'll be more important things. But it may also be just some sense of feeling dazed or confused. Having your bell rung is having a concussion. You may just feel dazed, confused, or just kind of lost your memory for the event or what have you, but that's what a concussion is. Lots of different symptoms that can go along with a concussion, most of which are short-lived, and you'll hear that tonight, but again, in a significant minority of patients, depending on what literature you read, it could be 10% or 20%, whatever that is, we're not completely sure, will go on to develop more lasting problems. You can be very fatigued, you cannot fall asleep, or perhaps sleep too much. You may be confused, you may have difficulty paying attention or concentrating, your balance may be bad, or you may just have a sense of unsteadiness, and you'll get a talk on this later tonight in our last talk. Folks may just have this sense of, you're just more irritable, you just get angry much easier than you did before, or you're just more depressed, or you're simply just anxious. You may be more sensitive to bright lights or loud noises. Headache, a big problem. So I will tell you that for folks who need treatment, it's best to have a team approach. It's just not one specialty or one type of professional that can treat these folks. It requires a village. No, it requires NYU. What we have at NYU is a concussion center that brings together a lot of different specialties that all contribute something unique to the management, assessment, treatment, if you will, of folks with concussion. And tonight we're launching our concussion center, which is why I think tonight is such an important event. We've included the departments of neurology, the Rusk Institute, nursing, orthopedic sports medicine, our emergency department, our division of radiology, particularly neuroradiology, psychology, all these folks coming together to make sure that the people we treat with concussion get all that they need to get better. Our mission at the Concussion Center is threefold: clinical care, like I just told you. We want to be able to provide education regarding concussion, treatment, prevention. I think that's why a lot of you came here tonight. But we also realize that we need to bring all the value and strength that NYU has to offer to provide research to make sure that we're better at diagnosing concussion and developing better treatments. And that's what we hope to do. Tonight, our agenda is an overview. I've already given you some of that. We're absolutely delighted that we have Adam Graves here from the New York Rangers, who's going to give his personal perspective on concussion. We're going to get a talk on the concussion conundrum from our chair of neurology. We're going to discuss decisions on how and when to let our children return to play. Equally important in returning to play is when to return our kids to learn. When is it appropriate to provide them the education that they need? And lastly, we're going to talk about a very common problem, which is balance and the impairments that occur after concussion. I don't want to take up too much more time other than to say that who people with concussion go to is important. I came up with when I was doing a talk on mild traumatic brain injury 20 years ago. I know I don't look that old, but I am really. I came across this saying, you see what you look for and you look for what you know. This is so true in medicine. If you don't know what a concussion is or what the signs and symptoms of concussion are or what the problems are that are associated with concussion, you will miss them, and that is true. So I think it's important that when children, adults, whoever with a concussion who seeks medical treatment, make sure you're going to somebody who really understands what a concussion is. You'll find out tonight that one of the most important things that we provide, or the education that we provide, is to really make sure that our patients are resting so that they can recover. There may be some other things that we'll need to provide. You'll hear about that tonight. But in closing up, and I'm exactly 12 seconds over, I just want to leave you with a thought that concussions are very common, and it's a bigger problem than we ever thought of before. It really is a silent epidemic, and although symptoms are typically short-lived, they can go on to develop into more chronic problems. Education is a mainstay of how we manage folks, although we can intervene with rehabilitation therapy, medicine, or all the other therapies that many of my colleagues in other fields provide. So with that, I thank you for your attention.